how do you pick the person, the surgeon, the center to do your laser vision correction? How do you know who to trust? How do you know what makes sense? Boy, it seems like everybody doing this is the best and renowned and did this and did that. How do you know any of this stuff is true? Why is it some people just get great outcomes and some people end up with these horror stories? And it's kind of scary, right? You could say, well, 96% of people in the, in this big study had a great outcome from LASIK, and, you're sitting there going, well, what happened to the other 4%? What about them? And, that's not comforting if you're the 4%. So how do you do that? Well, we've got a separate video on fixing LASIK complications. How about avoiding them in the first place? Okay, how about getting a good LASIK procedure? How do you know? How do you know who's really good? How do you know what's really good? Well, let's first talk about equipment, okay? And let's talk about procedures. As I mentioned in other videos, equipment is actually pretty important to avoid LASIK complications. Some of the worst complications come from equipment or laser systems that cannot keep up with eye movements, track slowly, and make incorrect shapes, or lay the incorrect shape down incorrectly because it's not tracking the eye properly. And so the person ends up with irregular astigmatism. That ends up with the ghosting, the double images, the "you've ruined my life forever" LASIK. That's what occurs with those patients. How do you avoid those? Technology, technology, technology. The fastest trackers and the fastest lasers not only move as quick as your fastest eye movement, they actually decrease the chance of a decentration or an irregular correction. And on top of that, they're really a lot quicker. So a laser that takes 30, 40, 50, 60 seconds, and let me tell you, being under a laser, as someone who's under there, every second feels like an hour. So a faster laser is really way better. So this machine works at a 500 hertz laser. The fastest eye movement is 0.2 seconds or 500 hertz. This can follow a 500 hertz eye movement, the fastest eye movement. It's got a 1,000 hertz tracker, which essentially double over samples it. Okay? And you have to ask these questions. Hey, how fast is your eye tracking system? Certain lasers, popular lasers out there, have 50 hertz tracking system. That's a 1/10 of the speed of the fastest eye movement and a 1/10 of the speed of that laser head, and a lot less, a 20th of the speed of the tracking system. Okay? And so you've got a situation where there's a much higher chance of decentration or these big problems, right? The big LASIK problems with that. So how do you avoid that? High-end equipment. Why doesn't anybody use it? Expense. These things are a lot more expensive than buying one of the other machines, which are available for a fraction of the cost used, are kicking around everywhere. And so it costs a lot less money for a center to start up. And a lot of times they can charge lower prices. Okay? So you want to avoid that 4%, you need technology. Second, there's been a movement toward making corneas better than human normal, getting rid of the flaws. And this is an ongoing movement that I've been involved with, and this is how we're understanding that we can remove the flaws in the cornea, not just nearsightedness and astigmatism and farsightedness. We're talking about the little ripples, the whoop-de-doos, the little irregularities in the cornea, because people were made in a mom and they were made in a womb. They weren't made in a factory. And so everything is asymmetric. By removing those, we create a better focusing system that focuses the light properly on a cornea, gives a more homogeneous image on the retina. The retina itself is the sensor of the eye, the digital sensor, the film of the eye that sends the image to the brain to processing. The better the image we can get on the retina, the better your vision. And so there are systems now that can create better than normal human eyes, correct astigmatism better too, correct the flaws. And those are topography guided systems. Some wavefront systems purport to do that, but so a lot of these systems haven't necessarily, that they say purport to do it, haven't necessarily been shown to improve the cornea, which we define as the reduction of higher order aberrations. Higher order aberrations are the irregularities in the cornea. Lower order aberrations are those that are astigmatism, nearsighted, and farsightedness. Okay, and so when we reduce that, we make for a better cornea. That's great stuff. You can look for that. You can ask for that. You can ask questions about this. And those systems, unfortunately, always cost more money. And because of the way the United States does things, we don't just buy these lasers for $300,000, $400,000, $500,000. We also have to pay every time we use them, and they want more money for using those systems. Okay? And so not only is that laser more expensive, every time I use it, it's more expensive than a laser with a slower tracker. And every time I use it for creating a better than normal, a supernormal cornea, that's more expensive. It's just the way it goes. Wish it wasn't that way, but that's the way it is. The technology has even when you own the laser, a subscription component to it. Okay? And so what we then have to look at also is the LASIK flap. That is less important. People talk about we have this flap machine. As long as you get a nice flap, that's great. Okay? However you make the flap, as long as you get a nice flap, we use a Wavelight Alcon FS200. I think it's one of the best devices to make a flap, but certainly a Zemer makes a nice flap too. You know, there are many machines, but that doesn't really change your vision. It doesn't affect your vision, just made a flap. The flap is an access to the bed to do the laser. That's it. If you make a nice flap, you get a nice access. There you go. Okay? As long as you can get a good flap out of a machine, it's not going to affect the vision. Good. That's one way also is to prevent complications is just make sure you have a machine that makes a good flap. I don't care what the machine is. Just get a good flap. Also, it comes down now to the surgeon in the center. Okay? How carefully do they do those measurements? Who's doing the measurements? A lot of our measurements are actually now, because we do a lot of work with supernormal corneas and we do a lot of corneal repair, actually come from the systems, right? But those numbers are also dependent on my techs making sure they got good scans. The better the scans, the better the segmental reconstruction that we do, okay? If a tech doesn't get a great scan, you might not get as good an outcome, okay? When you're just even looking at the refraction alone, if you're not using a system like that, who's doing the measurements? You know, I got to tell you, it's amazing how many patients that I have seen in glasses that are incorrect or the measurements are wrong. Sometimes measurements are tough. Getting people's refractive error is tough. You know, I've been doing this for 30 years and I still, 30 years measurements, 26, 27 years laser eye surgery, I still do the measurements on every single patient myself. Okay, still do. You know, if I have enough time to do this, I figure every surgeon who's going to do a procedure should do that as well. Okay? And that's important. And so, and how else do you know? Well, the surgeon talks to you. If you just meet somebody and the surgeon's just going to do your surgery, none of this stuff we're talking about really happened, did it? Okay, you didn't get a proper refraction, maybe. You didn't meet the surgeon. Did the surgeon actually look at all the different parameters to see if we can make a supernormal cornea? Okay? What's happening here? What's going on? And part of that also is in the care afterwards. Like we talk about LASIK complications, everything from these low incidence infection to inflammation, but dry eyes, these kinds of things. Fabulous treatments for this stuff. But somebody's got to treat it. Okay, so you better have a surgeon who's hands-on enough that when you're the person that runs into the dry eye problem, it gets treated. And you just don't kind of get left out in the cold. In other words, you get care, you get follow-up care. The price you pay for LASIK is not just for the laser procedure, it's for also the care afterwards. Is that center also measuring your cornea? Can it diagnose a problem? Does it take images afterward to say, hey, do we make a good cornea, or do we end up with a decentration, or do we end up with an incorrect shape? And that's the reason behind these problems. The technology exists today to do that. And if a center doesn't have the ability to do that, then they should refer the patient to somebody who does. So these kinds of things, like when someone runs into trouble, that's the great thing about LASIK. When it's done right, it's still great a whole big chunk of the time. What we're trying to do is get those patients that are the smaller percent, because you don't care about statistics if you're one of the few percent. So the whole idea is the surgeon has to measure you. They have to know why you're having a problem. They got to have an explanation, or look for one when you have an issue. Okay? That means interaction with the surgeon, interaction with the staff. Because, like I said, if everything goes great, who cares? You know? We don't need any of that. But if you're one of the few percent where it doesn't go right, then you need somebody who knows what they're doing. And what I say about this is, it's an 80-15-5 rule. Okay? 80% do everything I want, and you could have a trained chip do it. 15% need extra care, and 5% need a whole lot of extra care. You don't need a whole lot of me in the 80%. You really need me in the 20%. How do you know if you're going to be the 20%? You have no idea. None. I have patients with super high corrections. I can do a -10, 11, 12, and they do everything I want, and everything's perfect. I can do a +6 and everything's perfect, and I have a problem with the +1. Okay? This is because of factors that deal with the fact that you're a human being, and some people react differently than others. So a surgeon better know what happens when something goes wrong and how to fix it. Okay, that's really the defining line between a real refractive surgeon, a really good refractive surgeon, and one who just does LASIK. Okay, and if they don't know, send them to somebody like me who likes working with tough stuff. Okay, not everybody likes that, fine, but just send them to somebody who likes working with tough stuff. Okay, but a real good refractive surgeon knows when something goes wrong. Ask them, what can go wrong, and how do you fix it? How do you take care of dry eye? What happens if there's a decentration? What happens if I have blurring? What happens if I'm, if I get halos? What happens if I have these problems we talked about? Get an answer. And if you don't, maybe you want to look at somewhere else to go. This is the same thing I do when I'm getting a surgery. I really don't look at where the doctor went to medical school. It doesn't matter to me. What really matters is when they sit there and they talk to me and they tell me this is the problem, this is the approach we're going to take. And if I sit there and I ask them, what happens if this happens or this happens, they have an answer. They have an answer. They have an answer. And the answer is based on data and research and studies and good, plain common sense. Because sometimes, I got to tell you, a lot of doctors, I love them, they're smart as heck, but because they get so deep in the data and they're so deep in the stuff, they lose that little bit of practicality, right? That pragmatism, right? And sometimes you sit there as a patient and look at them going, hey, are you with me? Or, can you please help me? Because this is a practical problem I need to treat as well. I got to live a life. Give me some real straight answers. And ask those. There are plenty of guys out there that can do this, and the ones who can't give you straight answers to the simple questions of what happens if this goes wrong and this goes wrong and this goes wrong, if they can't answer that, maybe you want to talk to somebody else. Okay? But this is an incredible procedure. I was a -10. Okay? It's really nearsighted. Okay? I had my original procedure years ago, then revised with my research protocols, and I have incredible vision because I made a supranormal cornea on myself. Okay? This has been a godsend, even the original procedure, because it gave me a liberating feeling like you cannot imagine. Okay? And so these are things that honestly change people's lives. But let's make sure that you make the right decisions when you change your life.